said, I'll be presenting my oratory piece on healthcare bias. When I was younger, I was obsessed with Doc McStuffins. This little black girl with her twin plaits who spent her days caring for her toys as she emulated her mom. A doctor. I mean, I was in awe of this world where this black girl and her black mom had warm adventures in the world of medicine. But as I grew older, I realized that the relationship between Black Americans and the healthcare system wasn't as warm and full of trust as the show had portrayed it to be. Black Americans have a long history of unequal treatment within the medical field. For example, we can take Betts, Lucy, and Anurka, the 3 enslaved black women who were the unwilling subjects to Dr. Sims, the man we now know as the father of modern gynecology. These 3 women had to undergo painful gynecological experimentation that led to advancements within that field. Or, we can take the Tuskegee experiment, in which 399 black men were lied to about being negative for syphilis, just so that the government could observe how it progressed untreated. And let's not forget Henrietta Lacks, whose cells were taken without her or her family's consent and used to create the immortal HeLa cell line, which has been utilized for generations in groundbreaking technologies and innovations with no profits or recognition towards Lax's family until very recently. This history of unequal treatment has led to a degree of mistrust for Black Americans towards the medical system. And this mistrust, when coupled with socioeconomic factors, has created a society in which Black Americans face disparate health outcomes when compared to other races, with the difference being the most stark when compared to white Americans. I know we've all heard the phrase, "Black don't crack," referencing that due to the blessing of melanin and a culture of skincare, many Black Americans will remain wrinkle-free and look decades younger than they actually are. But did you know that Black Americans actually have a biologically advanced age of around 2 to 3 years and a life expectancy that is 6 years shorter than average? This disparity starts at birth, with more than twice as many Black babies dying during birth as opposed to white babies. And these staggering statistics, they also carry through into maternal mortality. Out of every 100,000 births, 51 Black mothers die, as opposed to 14 white mothers. Although there are many factors at play here, one that we cannot afford to overlook is the role of bias. A study by the Commonwealth Fund found that 50% of healthcare providers were more receptive of white patients advocating for themselves as opposed to Black patients doing the same. Take the example of Serena Williams, the greatest female athlete of all time with a net worth of over $300 million. Even she almost became a statistic when she faced trouble breathing after giving birth to her first child. Despite a history of pulmonary embolism, doctors initially overlooked her complaints, and Serena Williams literally had to beg for her life until doctors relented and gave her life-saving treatment. Imagine that. Despite her wealth, her power, her fame, her influence, Williams's condition was overlooked as a result of the bias of the doctors who were supposed to be treating her. Now let's look at some more numbers. Despite making up 14% of the United States population and just 6% of heart disease cases, Black Americans make up 22% of all heart disease deaths. A study by the National Association of Health found that Black and Brown Americans were less likely to receive adequate treatment for diabetes, care for stroke, cancers, and more. And the same study found that Black Americans were more likely to die of these diseases, even when all other factors were equal to those of their white counterparts. So the question is, how can we work to prevent this problem that has thousands of us dying of perfectly treatable conditions just because of the color of our skin? One potential solution is that we need to have more Black doctors. And this can start by convincing kids my age that a career in medicine is a realistic possibility. Amen. Not only will more Black doctors provide new perspectives, they will help create a more healthy, safe, and welcoming environment for Black patients. Unfortunately, this is more easily said than done, with the average cost of medical school alone averaging at over $230,000, making it cost prohibitive to so many. There's an urgent need for more cost-effective paths to a career in medicine. Now, as I approach the end of my junior year of high school, I started to realize full force the impact of healthcare bias on the Black community. 60 years after Dr. Martin Luther King spoke of a dream where we are judged by the content of our character and not the color of our skin, and 20 years after Barack Obama proclaimed that there was no Black America or white America, but only the United States of America, health equity continues to elude Black Americans. It is imperative for the well-being of our society as a whole that serious work is put into building trust and empathy between Black Americans and the healthcare system. At the end of the day, these numbers are a stark reminder that representation matters. And for Black Americans can be the difference between life and death. Thank you.